Okay. Good afternoon. This is Shannon Christian in the Office of Child Care. I am delighted to welcome you all here today and to introduce some of the local and state innovators and groups that include nonprofits and for-profits and public sector and private sector and everything in between, CCR&R. So this is definitely a group effort, and I'm glad to be here. I still see the same slide. I'm sorry. There we go. So that is a list of our illustrious presenters, and we're lucky to have them all here together at once. You'll see it's a big variety of people from a lot of different places. Next slide. We have some learning objectives today that include learning about innovative state and local solutions to address emergency child care for the essential workforce. We're going to discover how child care and development fund dollars and flexibilities can be used to fund supply and demand projects like those presented today. And we're going to connect with colleagues who have adopted these solutions and ask questions about these innovations. We have a team to present, and the group is called Emergency Child Care Solutions, ECCS, and it is made up of the 4 entities that you see logos for at the bottom of the screen. And now it's my pleasure to introduce a longtime friend of mine who I admire greatly, Lynnette Fraga, the Executive Director of Child Care Aware of America.
Thank you so very much, Shannon. Thank you so very much, and thank you for having us on this important call. In these very challenging times, it seems that we are all grappling with difficult decisions on how best to provide and support child care, and our approaches differ across the nation. That said, as we make these key decisions, it is critical for our children and to our families now and into the future that our systems and processes ensure safety, standards, and equity. Specifically for today's discussion, the systems and technology that we put in place during the pandemic will define how these systems work in the future. That is why Child Care Aware of America has brought this rapid response partnership together to ensure that the children of essential workers have access to quality child care today, and that every child in the United States has access to such care in the future. And to the national network of over 400 child care resource and referral agencies that are local, on the ground, working directly with families and with providers, they are critical conduits for these kinds of effective partnerships. We are excited to bring together systems and data to enable data leadership and continually elevate and transform child care. So I'd like to introduce now Jamie Herbert, the CEO of Bridge Care, our first of 3 partners that make up the Emergency Child Care Solution. Jamie?
Thank you so much, Lynnette. My name is Jamie Herbert. I'm CEO and founder of Bridge Care. And each of our 4 partners that make up the Emergency Child Care Solution kind of represent a different domain expertise and value that we bring to the groups that we work with. And at Bridge Care, one of the biggest high-level values we bring is understanding of user experience. So I quickly want to touch on what is user experience. And I think this visual highlights it quite well. A lot of folks, when they think of user experience and what a parent or a provider or a stakeholder of any kind interacts with, they think about the design first and foremost. And design is kind of the tip of the iceberg of what is true user experience. Because real, true, good user experience is grounded first and foremost in research, in the understanding of the problem and the pain point that the end user is experiencing, first through understanding, then through defining, exploring, and then finally last creating and designing. And so at BridgeCare, we have done the research and continue to do the research of interviewing thousands of parents, providers, and stakeholders across the country, and designing a really unique and high-end user experience to help create the solutions that meet the needs of our kind of modern technology age that have never been more needed and more expected of the folks that we are serving. And we don't just do this to have a nice looking good solution. We do this because we are making tools that people want to use. We do that because when people use the tools, we collect more data, and when we have more data, we have more insights. And those insights help inform advocacy and policy initiatives at all levels. And that's why it's part of this much bigger collective. And so that research that we've done and user experience takes form in our many options for parents, providers, and R&Rs and local organizations on the ground to engage in these efforts. We can construct them in different ways for state and local efforts, and you'll hear about some of those examples here shortly. Next, I think that's a great segue into our partner from Bowtie, Brian Schultz, who is president of Bowtie. Take it away, Brian.
Thank you, Jamie, and hi, everybody. I am blessed to kick off the boring part of the conversation. I promise you, there are only a couple of slides on this, and then it gets back into the sexy stuff, which is what you see and use on the front end. But quickly, when we're talking about and let me scroll down one page. When we're talking about making these sites work, as each of you know in your states and communities, that there's lots of data, but that data tends to exist in lots of different data centers or data silos. So how do you capture that data effectively and easily? And then, of course, there's the data that doesn't exist. So are the child care centers available? Are they open? Do they have spaces available for infants, for toddlers, et cetera? And then being able to push that data or pull that data together and share that through a front end and also through reporting. And that is the underbelly of what makes all of this work. It's extremely complicated, but what Bowtie has done is built a layer specifically for this, from the extraction of the data, the transformation of the data into something that can be used, and then the loading of that data, be it into a data layer, and Shay from Texas will show that to you later, or into the front end, which is what Jamie just showed you in terms of how that data is presented to a parent or a CCR&R, et cetera. Now, that's a lot of data. That data is collected. It tends to be proprietary. Some of it should be shared. Some of it shouldn't be shared. And that is all governed by what's referred to as a data trust. So my colleague, David Goodman from Bright Hive, is the head of Datatrust for that, and he's going to speak briefly about what that means and why we've incorporated it here into the solution set, so that you can rest easy as you move forward with us. David?
Thank you, Brian. I appreciate that. I am David Goodman. I'm the head of Datatrust at Bright Hive. We are the data collaboration company, which is an interesting way of saying that we help you worry about all of the legal, technical data specifications on how to actually facilitate what Brian and Bowtie and Jamie and BridgeCare are trying to do to capture that data, integrate it, and present it to solve those thorny data collaboration challenges that you all face with the child care vacancy data. What is a data trust? A data trust is essentially the components that are all, that many of you already know about what it takes to share data. So it's the legal agreement, it's the technical infrastructure, and the one thing that is often overlooked that we really emphasize is the ongoing governance of that data. How can we, as data providers and data users, continue to manage and monitor and sustain that infrastructure and that legal agreement over time so we don't have to reinvent the wheel, rebuild the infrastructure every time. We can continue to leverage it, iterate it, and allow it to evolve with our data collaboration needs and challenges. Bright Hive does this. We help build Datatrust at many different levels in many different fields. Here's just an example of some of the work that we're doing within states, in the state of Colorado, in the Commonwealth of Virginia, in the state of Kansas, but also working with regions, often starting with county government or initiated by philanthropic organizations to help build regional data collaborations so that they could share data, work together, combine their data to broaden their insights, and help achieve both their individual organization's impact but also their collective impact. We're also working with a lot of large regional and national nonprofit networks like Goodwill Industries International or United Way, and currently working with Jobs for the Future on a project that's supported by Google to create regional workforce data trusts that will combine data in different regions and that will inform a national data workforce data center in Nashville, Tennessee. And we also work in the space of some of these standards organizations. So where there is questions about what standard to use with data and sharing and integrating, we can recommend some of those and also adopt those that you currently are using. We're very excited to be working with BridgeCare, Bowtie, and Child Care Aware of America, and really appreciate the Office of Child Care for allowing us to join this conversation today. Thank you. And I will turn this over. Well, actually, I'm going to do one more slide. I do apologize for that. Having said all that around data governance, for the emergency and this emergency solution, we are putting together a starter pack. So it's not a full data trust, but it does allow you to have the data trust, what we call a rapid response data trust agreement that you can use very quickly to define the data and technical specifications that are needed to share this data through this solution. We will provide a how-to guide for organizations to do this on their own, and we'll also provide some additional consulting to help you and your partners get this agreement up in place. It's a framework that will can be used quickly, but it's also one that can be expanded upon once the emergency phase has subsided and you and your partners are beginning to think about how you want to expand upon the data trust that you've created to solve this immediate challenge, but how you want to use it to bring in new partners or new data or to answer new questions. So we'll be available to help you through that as well. Thank you. And I will pass this on.
Oh, you can pass it on. Okay, we'll both pass it on. It's Shannon. I'm going to turn this over now to our state and local innovators, starting with Soraya Pena.
Hi there. Thanks for the introduction. I represent the Best Place for Kids, which is Fort Worth's whole community approach to impacting childhood and family outcomes through education and economic development initiatives. And this initiative exists to ensure that every child has access to quality education starting at birth, that families are connected with key local resources, and that businesses are supported with strategies that benefit working parents and their bottom line. Making Fort Worth and the broader Tarrant County known as the Best Place for Kids has become the shared rallying point and the natural outgrowth of early education work over the last 7 years here in our community. And because of these incredibly collaborative efforts, Fort Worth is honored to be considered as a national leader in our approach to quality early education. In fact, we're one of only 3 U.S. communities highlighted as a national model for early education, and we're creating a business case for what family-friendly business practices looks like through our Best Place for Working Parents initiative. The Best Place for Kids operates as a public-private partnership led by Fort Worth Mayor and other local partners, including the City of Fort Worth, philanthropic partners, nonprofits, business leaders, and experts in quality early education and education policy. Ultimately, we're dedicated to lifting up innovative practices and broadening support for strategies that make Fort Worth the best place for kids. As a brief overview for Fort Worth, for those who have not been here yet,
We are the western bookend of the sprawling DFW Metroplex. We're the 13th largest city in the United States, just shy of 1 million people, and we're the fastest growing large city in the U.S. with a thriving economy. And most importantly for our discussion today, we boast the second highest percentage of families with children in the United States, which in Tarrant County breaks down to about 482,000 families with children. Can we advance to the next slide, please? As a brief history for how we got to this unique solution to what we're all dealing with, the Texas system of child care is managed both by the state agency, but subsidy and quality funds are managed by local workforce boards and their contractor. So part of the Texas story of child care during COVID is necessarily a local story because disaster relief, as many of us know, is always a local issue and challenge. So in our community of Tarrant County, which includes 2 large cities, both Fort Worth as the 13th largest and Arlington as the 50th largest city in the United States, our elected officials and city and county managers are actively engaged in these issues, including child care. So as COVID emerged, child care was called upon early to be involved in our coordinated emergency response. Because we've long been wanting to answer in Fort Worth and Tarrant County the seemingly basic question of can I find open child care spots near my work and or home, we actually sponsored a bill with the City of Fort Worth held last legislative session in 2019 with a Fort Worth-based state rep requesting that the state of Texas build a search tool like the one we launched here in Tarrant County. The bill didn't go through in 2019, but because we had done the research on the kind of site that we would need to serve our workforce, families and child care providers, we were able to ramp up relatively quickly to take on this tool to launch and support our workforce and emergency needs in the COVID response. Our collaborative efforts pre-launch involved local philanthropies, early education experts, child care providers, Bridge Care, and Bowtie, who have worked tirelessly to create this unique community solution in the anticipation of the intensified burden working parents are facing in order to care for their children while meeting immediate community needs through their professional obligations. The way we've structured the initial rollout of this free child care search tool is to serve our immediate needs, as many others mentioned, during our COVID response, which is linking parents working at essential businesses while under stay-at-home orders with quality available child care openings around their work and or home. Initially, we rolled this out to essential businesses, starting with our hospitals, municipalities, first responders, but this also involves grocery stores, gas stations, construction, and the transportation industries. So this is what parents see. It's a very straightforward request. Parents are asked to fill out their initial information, including their email address. They input their child's name and date of birth for us to be able to help them identify the centers and vacancies that are available, and allows them to input their home, work, or other address that they'd be driving back and forth from to find centers that are along their commute. So this tool goes beyond any existing search options for parents employed by essential businesses that are seeking real-time information that includes availability and quality details on child care options near their work or home for children ranging from 0 to 12 years of age. A couple of unique factors I just wanted to point out if we could go back to the last slide. This unique factor actually allows users to see the time it takes to get to and from a center on their commute, whether that is in their car, on public transit, or cycling or walking. We know that parents get to child care centers in a variety of different ways, so that's a really unique factor that we're grateful for. And it allows parents to list multiple children that they need care for, as well as unique filters for other considerations of care. And I think the other thing to mention is this puts all the accessible information into one place for parents. So there's links to licensing information and inspection details, quality rating, whether the center accepts the subsidy, emergency financial assistance from the Texas Workforce Commission, which the next presenter will highlight, hopefully, and the website for current information and phone numbers. So for all the other parents on the line that have had to deal with finding a child care arrangement, think about how many questions this one tool answers. And we're just really grateful for that opportunity. So upon launch on March 30th, the FIND tool had identified in Tarrant County 7,700 plus available licensed child care spots listed across Tarrant County for kids 0 to 12. And at that time, there were approximately 50% of the licensed child care centers open due to the COVID response. So as of this week, there's 7,100 available seats with still about 50% of the centers operational. As a background for how we got this data and how we got to where we are today, we gathered the initial data to launch Find in Tarrant County by deploying our local early education classroom mentors and navigators who logged about 1,200 hours on calls in 2 weeks to establish child care center data and availability information. These early ed class mentors who were now sitting at home became a critical point of contact for all open child care programs and centers, not only because they were able to determine availability, but they also had a sense of critical needs such as health and cleaning supplies that were lacking that we were able to respond to. We've now begun collecting the bulk of data from automated messages versus calling all centers weekly and supplementing that with calls to centers that are still adjusting to the platform or technology. We realize that the automated messages will serve as a high touch value with high response in the coming months for all parties involved, and we're excited about that. Since the state followed our lead and launched a search tool for all of Texas's frontline workers as well, this allows all provider information to update simultaneously while still ensuring our local touch points are specific to our needs. So working hand in hand with our local workforce board, CCMS, elected officials, and community partners, the Find tool is serving as the external-facing starting point for parents who need help finding care. You'll see on the screen that this is exactly what a parent would see if they're looking and being able to, favorite and mark and see exactly how they'll be able to, call and get in contact with the providers themselves. Just a little bit about why behind this push and how this fits into our short-term and long-term strategies as I wrap up. On the short term, our essential industry workforce is critical to our community's ability to respond to this current pandemic. Child care is a critical feature of any disaster response. And as I mentioned earlier, we were brought in early as part of our community's unique response to this emergency. The local CCDF contractor for our workforce board is Child Care Associates, and they manage the CCDF subsidies and the contracts for about 600 child care providers. They also look over the quality improvement for child care work, and they're the local Head Start and EHS grantee. So Kara Waddell, CCA's CEO, who also sits on the Texas Governor's Frontline Child Care Task Force, just indicated that this sophisticated platform provides innovative technology and analytic capacity that nonprofits and local communities have never had access to. So it's been especially crucial for informing our local COVID response because we know that disaster relief is always local. I'm thrilled that Tarrant County has been able to launch this for our working parents and families, supporting our child care providers and essential businesses. We're honored to be considered pioneers in this effort, and we've honestly learned so much through this process. The team at Bridge Care and Bowtie were able to help us turn our long-envisioned goal into a reality in a remarkably short time frame, and it allowed us to work with our trusted existing partners to collect meaningful raw data, including, for example, center availability, and bring in a hybrid innovative technology to provide tangible value to our community responding in this crisis. It allowed our child care providers, families, and businesses to know that they're being supported with a modern real-time resource. And I think one last thing as I wrap up and hand over to Shay, on the long term, the best place for kids is motivated to help working parents find safe and available child care options for their children while they meet essential workforce needs. And so while we realize and respect that child care is an incredibly personal decision, we're working to ensure that parents have greater access to information enabling them to make the best child care choices for their families, both now and once we reach a new normal. So for those of you that want to play around with this tool, I encourage you to visit the site, which is find.bestplaceforkids, the number 4, kids.com, and check it out for yourself. Thank you so much.
Okay, thank you, Shreya. Now we will turn to Shay Everett from the Texas Workforce Commission. Welcome.
Thank you so much, and I'm so happy to be here and talking to everyone today. So for those of you who don't know, the Texas Workforce Commission is the lead agency for CCDF here in Texas, and we have 28 local workforce boards covering different regions across the state that administer the programs that we have, which are the subsidy program and our QRIS, which is Texas Rising Star. You'll see it on these screens here. But it was so important for us having, with these 28 local workforce boards like Tarrant County, that we have an equitable statewide solution during this crisis to help give essential workers a resource to find childcare, while also allowing for local flexibility so that they have the option of using this tool and customizing it in a way that may help them go above and beyond what the state's initial initiative is. So this slide shows what parents see when they go to find.frontlinechildcare.texas.gov. It is also paid for, you can see here, with our CCDF funds. And we have integrated a number of different data sources in order to show this to parents. So we have child care licensing, providing data on which child care providers are open versus closed right now, what are their hours and ages served. We have my agency, the Texas Workforce Commission, providing whether they're in the Texas Rising Star program, or we have here accepts financial aid, because that seems to be more easily understandable than subsidy. We also then have the child care provider who goes in on their own to update vacancies, the contact info, and any other information. And so we really are integrating all of these different data sources to provide a clear picture to parents. What's different from the state level Frontline Child Care platform versus Tarrant County, Fort Worth local platform is that we are not collecting any personal information from parents. That was important for us to be able to quickly roll this out to meet the needs of essential workers, but it does have that capability. So this is how we collect provider data on this screen. The child care provider simply goes to a website, enters in their email address that's associated with their online child care licensing account that they all are familiar with, and they enter in their licensing number. And then all they have to do is enter in the availability for the 4 different age groups. They can do this as often as they'd like, and we encourage them to do it every time they have a significant change in their availability so that parents can have current information, or as current as we can get it. It's a very simple process. It takes less than a minute, and a provider can actually, if they have multiple centers, they can go in and in between steps 1 and 2, they can just select which center is associated with their email address through the child care licensing account. So providers get an email and or text push notification every 6 days requesting that they update the portal, because on the 7th day is when we clear out their availability and it will show unknown to parents. So that's a way for us to keep the platform updated and for to incentivize child care providers to update their information regularly. And then it's shown to parents in a certain order, where if the providers who have updated their information more frequently also show up. And it's also prioritized around quality and this, proximity to the search location. So there are a number of things that go into really getting that information to parents. But since this is voluntary for child care providers to use, we're trying to incentivize rather than mandate them to use it at this moment. And so we have been able to easily pull a list of providers who are using it versus those who are not, encouraging them to use it, having outside parties from locally that they listen to and are familiar with also push the same message. We're also considering other incentives like monetary incentives or access to supplies or whatever it may be to help them, the providers who are using it, get rewarded, and other providers to hear about it and start using it as well. So that's been one of the interesting challenges we face. But we have had about 25% of open providers use this portal over the last week. So it's gotten a lot of great traction since it's been released. Next slide. So this is what I can kind of see on the back end along with other colleagues, and it shows, we track the number of providers, the searches, the number of slots, and anything that we could imagine tracking with this data is being built and improved every day. We are also developing a view like this for the 28 local workforce boards so that they can track their regions, which will be very exciting. Again, another one of those solutions that gives some local customization, but with a statewide effort. I think the next slide. So these are just some more of the icons that we can see on the dashboard. If you could actually go back to the previous slide. Thank you. So one important thing I forgot to mention on here is the supply and demand. On the left, you can see the providers who are searching for or who are entering in their information, and on the right, you can see the parents who are searching. So the vendor is also developing some great other analytics so that we can see the supply versus the demand regionally and by age group, et cetera. Okay, next slide. So these are other widgets, that is what they're called, icons that are on this dashboard. And giving us access to these really helps us all see in real time what's going on, what can we respond to, and getting local, the local workforce boards and other communities access to information so that they can respond. And especially it's important as we are, the state's starting to set up various emergency child care centers and knowing where those regions are, where there's not an adequate supply of child care will be helpful in making sure that we can protect the current supply of child care through this pandemic. I believe that's it.
Okay, and now we'll turn it over to Michelle Figler from the Heinz Foundation to talk about the long-term vision of helping child care from the perspective of philanthropy. Michelle?
All right. Thank you so much, Shannon. Can you all hear me okay? Good? Okay.
Yep.
So thank you. I'm really honored to be here today. So for those of you that don't know, the Heinz Endowment is a regional foundation. We're located in Pittsburgh, Pennsylvania, and we give around $60 million a year overall in three areas: creativity, sustainability, and learning. The Heinz Endowment has had a deep commitment in early childhood education for over 20 years and was one of the founding foundations of the Early Childhood Funders Collaborative. And of course, like our partner foundations, when the COVID crisis hit, we immediately thought about the impact on early childhood education. I will have to say we have a deep concern about that moving forward, but the work that I'm going to talk about today is really what's more about how we're reacting to COVID. So like many foundations on the ground, we have joined with the Hillman Family Foundation, Victor King Mellon Foundation, the Pittsburgh Foundation, and our local United Way to really think about how do we respond to this crisis. We pulled together a fund of over $10 million now to really address the crisis, and what I like to say is react to it. And of course, some of the things that have come from our tables with county officials, our local hospitals, and our nonprofits is that there's medical equipment needs, there's PPE needs, there are food needs, and very quickly childcare for
for essential workers rose to the top. So we saw this as an opportunity for us at the Heinz Endowments, along with our partners, to think about how do we think about a solution now that's about essential workers, but also about solutions that can carry us into when we think about going back into the workforce, and then also thinking about our system even a couple months out. So how do we think about it now? How do we think about it when we return to our whatever normal is? And how do we reimagine our system? So it was actually an opportunity that came to us from our partners, which is the Early Learning Resource Center, which is our child care resource and referral agency here, and who gets their dollars from the Office of Child Development and Early Learning, so CCDF dollars, and also our county executive and their partners trying together, which is our local association for the education of young children, and also our 0 to 3 early intervention provider. So the partners coming around the table saying, how do we use the system we have, our system, to really think about this critical need right now? And because we had the opportunity to sit with both of our health systems, saying they were saying to us, we really need to find essential care for our workers, especially as child care centers closed and family child care providers remained open and child care centers got waivers. They said, we really need some help here. And it was really an opportunity for one of the first times to see our private sector leaning in on our R&R system, saying we really need some help here. And that's when we stepped back for just a second to say, how do we invest in something that will help during this crisis, but will also carry on and really leverage the CCDF dollars and our really strong R&R system. So we have incredible partners on the ground. So we were very lucky that very quickly the Commonwealth stood up a parent portal that made it very easy for parents to find who was open, who was closed. But on the ground, what we were hearing is that our essential workers, especially the hospital system, wanted something a little bit more. So what they really started to value by being in a conversation was the value of the high touch relationship with the R&R system. I kind of talk about it that it was an opportunity for the hospital system's employee assistance programs to meet up with the CCR&R system. And it was then when this sort of aha moment was, how do we bring these two systems together to not only stand something up that could help families right now, but also moving forward could really help employers help to have a system that they can send their employees to really have a high-touch system. So I will have to say that all the time moved very quickly, but because we had so many good partners on the ground, and I just have to give a shout out to the partners on the phone, Child Care Aware, and it was just amazing, Bridge Care and Bowtie, and watching the work in Dallas, that we were quickly able to get all of the right partners at the table to think about how do we do this here locally. And I think from a foundation perspective, why my colleagues, especially at the Hillman Foundation, have been so excited about this is because it allows us to use our philanthropy dollars to address the crisis now, and philanthropy all over the country is looking at those kinds of investments. But it's also about how do we think about the field moving further too, right? So it's not just about the crisis. It's about investing in a system that really leverages the incredible public system we have. And I think when it comes to our work, we want to be able to do both. I think the other thing I'll add is that this system, while it will help families be able to find care now, it will also have opportunity to really build into it is how do we have a way for families to find fund one-on-one care. And we were hearing from both of our hospital systems that because of the public health concerns, they really wanted to be able to also help some of their employees do some one-on-one matching. And that's when we really turned to Child Care Aware to say, but we want to make sure that the opportunity that we help employers with is really about how do we ensure quality, how do we ensure equity, and how do we build off the workforce we have now. So we were very committed to making sure that we could utilize the current workforce and that we could value the early childhood system. I'm going to be honest with you, we got a little worried that people wanted us to go down a path of just saying we need to find care, any care, and that's where my partners and I really said no. We really have an opportunity here to also help the essential worker find care, but also ensure that care can be safe, that the care can be of quality, and that we can utilize the system and the professionals in the system. So we are really, really excited about that part of it. I also want to share with you that I think it's a great opportunity for all of you on the phone to think about the relationships with philanthropy, and also, right now to deal with the crisis, but also to engage them in the conversations about how is the field going to look beyond this crisis. It also has been an excellent opportunity for us as a private philanthropy to sit with some of our corporate foundations, because this is where it really hit home for them that they needed to understand how do they help their employees find care. So it's just been an incredible opportunity to really marry that private philanthropy, that corporate philanthropy, and these public systems. So that's the conversation that I would hope that you all can have back in your state. So it has been a tremendous opportunity sitting in a philanthropy seat to think about, a small, a relatively small investment that's going to help now is also going to carry through. And that's probably the best ROI for anyone sitting in a funder's seat. So thank you.
Hi, this is Paula. Thank you, Andrew. Andrew's going to give us a little bit more information about how the CARES Act can support these kinds of endeavors on a state and local effort. Thank you. Andrew is our Director of Policy at the Office of Child Care. Off to you, Andrew.
Thanks, Paula. Yeah, thank you. So yeah, we just wanted to make the point that the types of investments that we've been hearing about on the call in child care databases, data infrastructure, data governance, the sharing and use of data, including for consumer education purposes or for internal tracking and analysis purposes, those are allowable expenditures under CCDF. And we also wanted to give you an update, as Paul said, about the CARES Act, to make sure everyone was aware that Congress recently provided an additional $3.5 billion to states, territories, and tribal child care and development fund lead agencies to deal with the COVID-19 impacts. And those funds were awarded to yesterday. The law talks about using the funds for continued payments and assistance to child care providers in the case of decreased enrollment or closures, so in order to maintain the child care supply and ensure that providers will be able to remain open or reopen. Funds can be used for cleaning and sanitation and other activities necessary to maintain or resume the operation of programs. And on the next slide, for child care assistance to healthcare sector employees, emergency responders, sanitation workers, and other workers being essential during the current response to the coronavirus without regard to the income eligibility requirements for those families. And the funds can be used for other allowable CCDF purposes. There is guidance forthcoming to assist state circulation tribes with the use of those funds, and we expect that will be posted on our website within the next few days. And in the meantime, look for that guidance. Once you read it, if you have questions about the use of those funds or about the allowability of initiatives such as those that we're discussing today, which, as we said, are generally allowable, lead agencies should please contact your regional program managers with those types of questions. And that's a quick overview of the CARES Act and funding update.
Thank you again, Andrew. I know that folks on the line will have lots of questions, and we've seen some of those come in on the chat line. Please continue to put your questions in, and we will go through as many as possible right here and right now. Also know that we will try to get back to any questions, get back to you with any questions that we aren't able to get to. You may also contact the presenters directly. We'll have contact information for you at the end of the call. So perhaps we can start with Lynnette. Lynnette, there are a couple of questions about partnerships and how people get connected. Perhaps you and Brian can talk about that and the interface between existing data systems.
Sure. Thanks so much, Paula, and thanks for the great questions. I am able to see some of them as they pop up, and I know one question was specifically around systems being able to talk to each other, essentially, and specifically systems like our national data system powered by work-life systems. So the simple answer is that this solution doesn't replace any of the products or services that you may already be using, like and that Child Care Resource and Referral agencies are already using, like NDS, powered by WLS. This group of professionals that we pulled together actually have the expertise from the data technology to work with existing systems to create solutions to strengthen the work of child care. So it really is about partnerships and making sure that the concept of the Datatrust that Bright Hive has developed really centers this on a governance structure that is at the core of the solutions that you've heard this afternoon. So each state and locality will look a little different, just as you heard on the call this afternoon. You can sort of think about it as Lego blocks. Each solution will look a little different and be designed within your own governance structure and preferences. And so our formal relationship as an organization, and certainly as all of our partners, will look a little different for each engagement, but the solid infrastructure is around interoperable data and this idea of data trust.
Thank you very much. We've got another question that's come in several times about how providers' information gets updated and how those providers are onboarded. So I'm going to toss that over to Brian.
Sure. Hi, everyone. So there's a couple elements here. There's the back-end data, and that information coming from state agencies or local governments in terms of child care licensing, availability, ratings, etc. And that's a conversation we have with those providers, and we integrate those systems to either have those systems push us data, or we will pull that data and we'll establish a refresh rate where we're able to grab that. On the other side, with the child care providers, if they have systems, and many do, we can integrate to those systems. But in the current climate, we're moving very quickly, and in place of that, sending out basically a hyperlink which when they click opens it up, gives them a quick series of instructions to put in their email address and their license number, which then pulls up the form you saw that Shay presented, and they enter their data. It's fairly intuitive. We've not had many questions come in terms of how to use it or what to do. If they do have questions, those questions come through the sponsoring agency. So in Texas, it comes through TEA or the Texas Workforce Commission. In Allegheny County, it comes through the sponsor there, and in Tarrant County, the sponsor there. And they have their professionals to manage that, but we also back them up. It's far simpler than it sounds, and we do most of the heavy lifting. Does that answer the question?
That sounds great. Thank you. There is another question, a simple question for us to answer is, will the slides be available? And yes, the slides will be available. We'll be posting them on the Office of Child Care website very shortly after this webinar. Another question that came in was something that Andrew can probably answer better than the rest of us. The question, Andrew, was, do you know whether the CARES Act funding is taxable when it goes to child care providers?
Yes, so I'm not aware of anything in the CARES Act that addresses that, but we can look into that and get back to folks. I mean, the funds would reach a provider typically through two streams, either through a child care subsidy for a specific child, or through a quality improvement initiative, like a grant for quality improvement or supply building. And as far as I'm aware, they would be taxed subject to the same tax rules as regular CCDF funds. But we can look into that more.
Very good. Thank you. We've got 4 minutes left till the end of the call. You are very welcome to put your question in the chat box, and I'll have to ask Karen and Michelle, are folks able to raise their hand, and can you open their line for them to ask their question in person if they'd like?
Paula, it looks like we've also got one more question here, and I can actually take it if that's all right with you. This is Jamie from Bridge Care. Okay, great. The question was, it's been answered in the chat in case anyone's following, but we want to just make sure it's said out loud as well for folks calling in about if the site is mobile friendly, as well as a question about providers with limited or no internet access, which I think is generally questions about accessibility and internet connection. So first I'll answer the part about providers, which is that providers can have communication by phone, by email, or by text. So that really covers our bases in terms of reaching them with the kind of form-like easy interaction that Brian mentioned. So there are different options there that, depending on who we're working with, they can opt in or out of. And then in terms of the user interface, accessibility by mobile, that is designed not only mobile friendly, but mobile first. And so what that means is that you do not need to download an app. In fact, it's not an app to be downloaded by phone, but we are designed so that it is an excellent experience, as I mentioned, user experience by mobile. And so it is accessible. Mobile phone penetration in the U.S. is very high, and so that's why it's very important for us to make sure that that is the case.
Excellent. Thank you very much. Now, there was one last question I want to make sure we get to before the end of our call. It was asked, how will these kinds of systems help make sure that we don't lose supply after the crisis is over? And that's an excellent question. That's the how do we help connect providers and workers in the longer term? When if a system like this is in place, and if providers are able to, in pretty close to real time, identify their vacancies, and if parents are going in and requesting child care in particular areas, we will be able to track where that supply and demand is in real time. Since we expect that the economy will come back in phases, a little different in one geographic area than the other area, and it might just be certain types of businesses that open up first and maybe others, we'll be able to track where the child care is needed, where the child care demand is, and any investments that we choose to make in child care to make sure that folks are able to stay open and have sufficient enrollment to allow them to stay open. We should be able to get those reports out of a system like this. As Jamie was saying earlier, first you have to know what your question is, what do you want to know, and how, and then you can design your analysis from the back end tables that we looked at before to help answer your questions and make the best use of our CCDBG dollars or philanthropy dollars or business dollars or whomever it is that your partners are in putting this into place. But I think it'll be especially important for employers in your area as well. With that, and with 1 minute to go, I want to again thank everyone on the call for your interest in assuring that children are in safe places while their families have to go to work, and your investment in the child care system. We all know that child care is like a road. You can't get to work without it. And we also know that child care providers provide more than care. They provide support, emotional support, as well as the health, safety, and development needs that families and children are so dependent on us now. Please make sure, if we could advance the slide to the end, if you want to hear more about this emergency child care partnership between Child Care Aware and the 3 Bs, as we've been saying, you see Jamie Herbert's email address on your screen right now. And in terms of any state folks who are working with CCDBG, please feel free to contact your regional program managers if you have any particular questions about the CARES Act or ways you might be able to fund this. So with that, I'll thank all of our presenters and all of you on the phone. Hope you have a very safe, healthy, and productive afternoon. Thank you.